All right. Hey there, Dr. Mark McCawley with McCawley Periodontics, and today I'm going to talk about the link between gum disease and premature and low birth weight babies. So this is kind of a timely topic when you consider the jump in quarantine pregnancies at this point. So what happens is, due to the hormonal response of pregnancy, we do see more severe gum disease in those that are pregnant. So the problem is that gum disease actually increases the odds of having a preterm or low birth weight baby by between 2 and 4 times. So that's a huge increase there. Part of the problem is you end up getting that gum disease bacteria that builds up, and if you're not removing that bacteria, or your body can't fight it off well because of the hormones, then you end up developing gum disease and you end up having more likelihood of having a preterm or low birth weight baby. So I recommend, if you're pregnant, you have issues, you have gum disease, you have bleeding gums, come on in, we can check you out, and we can make sure that your baby's as healthy as you are. All right, take care.